I've been thinking about it because now we are in election year. I see all our big politicians running around campaigning for their votes. They are telling people to register for the votes. They are now telling even the mentor people to be taken to the registration so that they can vote for them. But I've never heard any of them talking about what they are going to do with the mentor people in this country. I've never heard them talking about what they're going to do for the widows in the community. I've never heard any agenda talking about how we're going to reach out the people who cannot manage. Let me tell you, we have 80% of those who are mentally sick and vulnerable dying because of a simple disease as malaria.
That's right.
We have 90%, if I'm not wrong, because they cannot access to any health facility. Number one, because they don't have the money. Number two, if they go to the public hospital, there's no medication. They are being sent home to go and buy some medicine from somewhere else. Number four, they have not been reached in a way that the government can offer them the NHIF. It's only 500 shillings per family, to enable them to reach and to go to any other better hospital where they can get treated. But the agenda in Kenya is politics. The agenda in Kenya is talking about four big agenda. The agenda in Kenya is how we can beautify our country. But nobody is out there to talk about these vulnerable people, how we can reach them. Previous days I heard Raila saying he will give 6,000. That is not enough. What is enough is how can we reach them to make sure that they have health care services and cover, so that whenever they are sick, they can actually walk to get treatment in any hospital where they can manage to reach. Number two, we have been neglecting the poor or the vulnerable in the community in this country. We only talk about the business community, the business people. We don't talk about things that actually they are good if we talk about them. But we are living, by the time we are getting the leadership in this country, we don't only lead for those who are able or those who have a class, but we are leading each and every person. My first question to the conversation was, do we have the data telling us how many, for example, me, I'm coming from Homa Bay, how many vulnerable people we have in Homa Bay County? There is no that data anywhere in the world. Even if you've been asked, maybe the number that will be given is quarter of what is happening in the community. If the way the doctor said, if we asked today, how many mental cases do we have in Kenya? Apart from those who, their parents or their guardians have actually tried to reach to various or their hospitals to tell what is happening. We have a number who are just in the bedrooms. Nobody knows their cases. And thereafter, the Ministry of Security are there to walk into their homes and even arrest their parents or their guardians if they are doing something which is against the law. But we have